Treatment of dysphagia depends on the cause. So once the cause is identified, then it's treated. If it's infective causes, you treat. If it's inflammatory, you treat. If it's surgical cases, then the patient, surgical cause for dysphagia, you take care of that headlong. But by and large, patient may actually require nutritional correction, patient may require electrolyte correction, patient may require fluid, hydration, and all those other baseline care. Also, lifestyle modification for those who smoke, they have to stop smoking. For those who take alcohol, weight loss is very important. In some cases, those who are obese, it's very important to counsel them on weight loss. In our own case, in ENT, the major surgery we do for dysphagia is within the oropharyngeal area. Tonsillectomy is one major surgery we do for patients presenting with dysphagia. As I said earlier, tonsillar hypertrophy is a major cause for dysphagia in ENT for children, while for adult, gastroesophageal reflux disease. So if it's gastroesophageal reflux disease, we'll place on the appropriate medication and problem is settled or sorted out. Other units, for the maxillofacial, they take care of the maxillary or mandibular problem. If there's a fracture there causing a patient to have difficulty swallowing, there's a surgical intervention we do, which they can either do the reduction and fixation of the jaw that is being fractured. Dilatation can be done for patients with either stricture within the esophagus. So dilatation is done by the cardiothoracic surgeon. And if it's a foreign body within the esophagus causing dysphagia, it's removed. Foreign body removal is done during oesophagoscopy. Oesophagoscope is passed and then foreign body identified and removed from the esophagus. And then, of course, the dysphagia stopped. There have been cases where stents have been placed within the esophagus in cases where there's intraluminal compression or problem within the esophageal lumen, like a patient who has condition within the esophagus, achalasia, you put a stent there to keep that place widened. So that's very important. For Zenker's diverticular pharyngeal pouch, surgeries can be done to correct that. It can be either an open approach or endoscopic approach. But importantly, cricomyotomy must be done. Cricomyotomy is done, then diverticulopexy to keep the area of the pouch, it's kept sealed or kept tightened so that food does not go into the pouch. So diverticulopexy is done, and also or diverticulectomy. You outrightly excise the pouch. So that's diverticulectomy, very important. So fundoplication is done for reflux esophagitis. So there are different procedures that can be done. Either this procedure, fundoplication, is a surgical procedure done to further strengthen the lower esophageal sphincter to prevent reflux of acid into the esophagus and into the pharynx. So this is done to tighten the lower esophageal sphincter. You can either do a complete fundoplication or a partial fundoplication. So it's done also by the general surgeon or the cardiothoracic, or a combination of both the general surgeon and the cardiothoracic surgeon. So that's very, very important. Anyway, thank you very much for your time. Thank you for watching. If you have your comments, you can share your comments below. If you have a contribution, if you have any other thing to say, you can like, share this live video. Thank you. So we'll see you again. I'll see you again next time for another interesting topic. I really appreciate those of us joining. I see Dr. Ade, Nathaniel Kuse, Ogundoro Femi. I really appreciate every one of you. Sheon Adewale Fadari, thank you very much, and others. You are all welcome. Goodbye for now, till some other time.